Stop. Before you schedule that back surgery or get another steroid injection for your herniated disc, there's something your doctor isn't telling you about a breakthrough treatment that's helping patients avoid surgery altogether. Let me share something that might shock you. According to research in recent studies, up to 71% of back surgeries fail to provide long-term relief. Even worse, many patients end up worse than before. I've spent years helping thousands of patients with herniated discs, and I've firsthand found out that conventional treatments often mask symptoms without addressing the root cause. In this video, I'm going to show you exactly how spinal decompression therapy works to fix herniated discs when nothing else has helped. You'll learn why traditional treatments often fail, the science behind what actually works, and how to know if this could be the best solution for you. But first, let me explain exactly what's happening in your spine when you have a herniated disc, because understanding this is crucial to understanding why decompression therapy is so effective. Think of the discs in your spine like jelly donuts. Each disc has a tough outer shell and a soft gel center. When that outer shell is weakened or torn, usually from repetitive strain or poor posture or even injury, the soft center can bulge or leak out, pressing on nearby nerves. This nerve compression is what causes these shooting pains down your leg, the numbness, tingling, or even muscle weakness you might be experiencing. And here's what makes this so frustrating. Once that disc material pushes out, it doesn't just naturally go back in on its own. This is why so many conventional treatments fail to provide lasting relief. Let's look at why the most common treatments for herniated discs often don't provide the relief you're looking for. Pain medications, while they might help you get through the day, they're just masking symptoms. They do absolutely nothing to address the actual disc herniation or reduce pressure on the nerve. Think of it like putting a piece of tape over your check engine light. Sure, you can't see the warning anymore, but the underlying problem is still there. Steroid injections is another option, and these can provide temporary relief by reducing inflammation, but according to a recent review in the BMJ Open, they offer only modest short-term benefits with no long-term improvement in most cases. It's like putting out a small fire without addressing what caused it in the first place. Physical therapy, while strengthening your core muscles is important, if you have a disc that's actually pressing on a nerve, no amount of exercise can physically pull that disc material back where it belongs. This is why many patients feel frustrated when they're diligently doing their exercises, but still aren't getting better. Surgery, now this is often presented at the last resort, but here's what many doctors won't tell you. Up to 71% of back surgeries fail to provide long-term relief, according to recent studies. Even worse, many patients end up with failed back surgery syndrome, leaving them in worse shape than before. Now let me explain how spinal decompression therapy works to actually fix herniated discs, not just mask symptoms. This FDA-cleared treatment uses computerized technology to create a gentle stretching force on your spine, but here's the key. It's done in a very precise, controlled way that creates something called negative intradiscal pressure. Think about what happens when you squeeze a balloon and then release it. It creates a vacuum effect that pulls air back in. Decompression works similarly with your discs. That negative pressure actually creates a vacuum effect that can help retract herniated disc material back to its proper position. But it does more than just that. This treatment also reduces pressure on pinched nerves, restores proper nutrients and oxygen flow to the disc. It rehydrates and improves shock absorption, as well as promotes natural healing of the damaged disc. The science behind this is fascinating. A study in anesthesiology clinics of North America show that non-surgical spinal decompression significantly reduces pain and improves function in patients with lumbar disc herniation. Even more impressive, another study found that 86% of patients reported significant improvement, and with MRI scans actually showing disc material retraction and reduced nerve compression. You might be wondering if this could work for you. Based on our experience and research, spinal decompression tends to work best for people who have bulging discs, herniated or degenerative discs, experiencing sciatica, numbness or tingling, or those that have been told they need surgery but want to avoid it, and if you haven't found relief with other therapies. However, it's important to note that not everyone is a candidate, and that's why we always start with a thorough examination and review of your imaging to determine if this approach is right for you. Here's something crucial that many people don't realize about herniated discs. The longer you wait, the more damage can occur to the surrounding nerves and structures. Nerve damage can become permanent if left untreated for too long. This is why it's so important to address the problem before surgery becomes your only option. So think about it this way. Every day you continue with conventional treatments that only mask symptoms, you're potentially allowing more damage to occur. The best time to fix a herniated disc is before permanent nerve damage is set in. So let me wrap this up by addressing something important. I know you might be skeptical. Maybe you've tried other treatments that promised results but left you disappointed. That's exactly why I've shared the science and the research behind why this works, not just empty promises. The reality is you have 3 options right now. 1, continue with treatments that only mask symptoms. 2, consider risky surgery with a high failure rate. Or 3, try a proven non-invasive approach that addresses the root cause. If you're tired of temporary fixes and want to explore a solution that actually fixes the problem, I invite you to take the next step. We offer a comprehensive consultation to determine if you're a candidate for decompression therapy. Don't wait until surgery becomes your only option. The sooner you address a herniated disc properly, the better your chances for a full recovery. And if you found this information helpful, be sure to watch my next video where I break down the exact exercises that complement decompression therapy to speed up your recovery and prevent future disc problems. Click the video on the screen now to learn more.